I want to talk about something briefly that I've been asked about that really is, in many ways, a cutting-edge therapy that's been around for 400 years. And what is the cutting-edge therapy that I'm talking about that's been around for 400 years? It's hyperbaric oxygen therapy, known as HBOT, HBOT. It was actually first used in the 1600s. Came to the United States when the Brooklyn Bridge was being made. If you ever heard of Caisson's disease, people actually getting the bends basically from going deep down and digging out the footings for the bridge, and they have to put them in compression chambers. And in the 20s, they actually had this big compression chamber. It was like a resort people were going to. But when World War II came around, they tore it down, used the metal because we had issues with metal shortage. But the point is, hyperbaric oxygen therapy has been around for hundreds of years. This is not new. It's FDA approved to treat non-healing ulcers, radiation, necrosis, non-healing breast flaps, flesh-eating disease. It's about 15 different indications. When I did my hyperbaric oxygen certification, we spent 2 days just learning about all this kind of stuff. It's interesting how long this has been around. Yet people are scared. They have concerns about it because, like anything, if you do it the wrong way, you have problems. If you go in a 100% oxygen chamber and you don't have 100% cotton, you're not grounded, you take technology and you have a spark, it can blow up, which has happened. People have died in these things before, and that's one of the things that kind of scared me about it. But if it's one of those things, if you do it the right way, in the right situation, it's 100% safe. But why would you want to do this? Why would you want to dive, 1.5 to 1.7 atmospheres and 100% oxygen? There's a couple ways that hyperbaric oxygen therapy works. First of all, it just increases oxygen concentration. If you look at how much oxygen you have, there's about 760 millimeters of mercury of pressure in the atmosphere. About 140 of that is oxygen. So it's about 20% oxygen. By the time you get to your lungs, that 140 becomes 100. By the time you get to your mitochondria, it's like 4 to 6 millimeters of oxygen. So this big gradient that oxygen goes down all the way to get to your mitochondria. If you can jack that gradient up, all of a sudden you can have a lot more oxygen getting to your mitochondria, and you're going to increase the efficiency of your mitochondrial function. So that's the first way hyperbaric works, is by basically just improving mitochondrial function. But there's also about 8,000 genes that get upregulated with hyperbaric oxygen use, and you actually increase stem cells by up to 800% using hyperbaric oxygen. So all of a sudden, it has a lot of cool things it can do. And also, there's a seltzer effect, which basically, if you open a Coke and it fizzes, when you compress oxygen in your tissues and it goes out, and once you got a tank, you have that effect in your cells, and that effect can last for 46 hours after you get out of the dive. So actually, hyperbaric sessions can have an impact last for hours. So it's really cool, but what can it be used for? It's my go-to for traumatic brain injuries, strokes. It can have a really profound impact on individuals. Actually, it was one of the therapies I used for my daughter to help with her brain injury that actually helped with her vision and her writing. A lot of times, I've actually used it with some of my PANDAS or autism kids because it just improves brain function. It's a brain anti-inflammatory. It helps improve cellular function. Some patients who have chronic Lyme disease who can't boost their immune system up enough. If you're a patient who's hypermobile, has aches and pains, body aches and pains, Ehlers-Danlos, part of that whole thing is that you have low oxygen tension in your connective tissues. And if they're stretchy, you have poor vascular blood flow. You can overcome that with hyperbaric. And all of a sudden, you can actually get oxygen to the tissues. And oh, by the way, people with hypermobility tend to have more Lyme because Lyme likes low blood flow tissues, and that's a bigger issue in hypermobility. And all of a sudden, you can overcome that. So hyperbaric has a lot of interesting uses. Some people will mention, the hard chamber versus soft chamber. So this is like the deep dive versus the shallow dive. What I tell people is there's this literature looking at using, I believe, 1.08 atmospheres. And these were in like an animal model for Alzheimer's showing change in brain function. So we do have data that it can actually change blood flow, even at a super low pressure. But the devil's in the details. You get the therapeutic effect, the big therapeutic effect when you're diving 1.5 to 1.75 with 100% oxygen. If you have an acute brain injury, acute stroke, acute TBI kind of thing, concussion, then you do need to get closer to 2.0 atmospheres. You just need a bigger pressure. For chronic issues, using 1.5 to 1.75 can be helpful. But you do get a benefit with the soft chambers that go to 1.3. Again, the devil's in the details. When you do dive to 1.3, you're increasing the oxygen at the mitochondria, at the cell level we talked about 400%. So it's a big increase, but it's not, 1,600 or 2,400%, which is what you get with the higher numbers. But again, if you do it daily, and that's when you probably need a tank at home. Something else people talk about is going to the centers. Well, I'll go once a week. It's like the effect stacks. If you want to get the benefit of hyperbaric diving, you have to do it 5 days a week. If you do it 1 day a week, the effect on mitochondrial efficiency and stem cell stuff, that stacks and builds. You need to do it sequentially to get that impact. And some people just And that's where it becomes difficult because you have to commit to that. The other thing is price typically can cost anywhere from $150 to $250 a dive. If you want to start at 20 to 40 dives for traumatic brain injury, concussion kind of thing, up to 80 if you have stroke. My daughter's done 2 rounds of 40 and she does it 5 days a week now. She's done that for a couple of years. And at 19, she continues to get better. She continues her visions to the point now where she's actually able to read a cell phone without any problems. So there are a lot of benefits to it, but can you commit to that? And that's the problem. I think that's the 2 big problems with hyperbaric is the commitment to the daily use of it for a time and the cost. But it can be really super helpful. There are other ways you can kind of get similar effects depending on what's going on, whether it's peptides, whether it's sensory deprivation chambers, whether it's methylene blue, whether it's red light therapy. So those are all things to think about as well. Work with your practitioner, the person you're working with, to find if this is right for you or if there's other things to try. But those are some of my thoughts about hyperbaric oxygen, its utility, and how it can be beneficial to you. So if you have any additional questions, please put them below. If you have a topic you'd like to talk about, take a deep dive on, please let us know. And we'd love to just take a deep dive with you on a topic. Take care and we'll talk to you soon.